Hi, this lecture is Questions of Values and Ethics, and this is Riverside College of Health Careers, and we are continuing on with Chapter 2, which is Professional Ethics and Values. So, the objectives for this lecture are to evaluate the relationship between values and ethics in the nursing profession, determine the 7 basic ethical principles to an ethical issue, analyze the challenges and dilemmas clients and their families face when managing end-of-life care choices, advance directives, euthanasia, and the withdrawal of life support, apply a model to processing an ethical dilemma, examine the influence organizational ethics have on nursing practice. So our definitions, we have values that are judgments about the importance or unimportance of objects, ideas, attitudes, and attributes. They provide a frame of reference and act as pilots to guide behaviors and assist people in making choices. In order to understand biomedical ethics, it is important to appreciate the basic concepts of values, belief systems, ethical theories, and morality. Now, morals focus more on good versus bad behaviors. They are based on values and are learned through family systems, instruction, and socialization. So let's do a little warm-up. On page 14 of your book, there is a case study where doctors at the Massachusetts General Hospital for Children, they faced an ethical challenge when a pair of conjoined twins who were born in Africa arrived, seeking surgery that could save only one of them. So they were conjoined at the abdomen, pelvis, shared a liver and bladder, and had 3 legs. An exam by doctors there revealed that only one of the girls was likely to survive the surgery, but that both would die if they did not act. So the parents need to be aware of the risks of the procedure, and all of the involved medical professionals were comfortable with the ethics of the situation. Which child should live and which child should die? This conflict is not legal in nature, with no laws to guide the decision making. So who makes the decision? So if you were a member of the ethics committee, what decision might you make? How would you come to that decision? And which twin would live and which would die? So go ahead and pause now and reflect on those questions and answer them as how you would consider acting upon this type of a case, an ethics case. All right, so what has changed in ethics? In the beginning, in most people in a critical care situation would have died. So it's with the development of new drugs and treatments that allow individuals a chance at surviving such critical illnesses that we see today. So with such advances, it has enabled healthcare professionals to provide patients with treatments, in many cases increasing their life expectancy and enhances their quality of life. But with this, it brings drawbacks and perplexing questions. So some of the new questions are the advances created new questions for healthcare professionals regarding the use of technology. So how is technology used today in ethical dilemmas and decision making? And then also the concepts of life and death. How is death defined and when does it occur? What is life, and is there a difference between life and living? So with the value system, there are a set of related values. So these include intrinsic, extrinsic, personal, and professional. So with intrinsic values, they're related to sustaining life, such as food and water. Extrinsic values are values that are not essential to life. They include things like the value of objects, both physical and abstract. They also offer a means of achieving something else. Things, people, and material items are extrinsically valuable. Personal values are qualities that people consider important in their lives. Concepts such as strong family ties and acceptance by others are personal values. Professional values are qualities considered important by a professional group. Autonomy, integrity, and commitment are some examples. People will often adopt values of people or individuals that they admire. Example of nursing value may begin to value humor after observing it being used effectively with patients for healing. And then values also provide a guide for decision making and give additional meaning to life. Individuals develop a sense of satisfaction when they work toward achieving values that they believe are important. So, value formation, it means that values are learned. So, such as children learn values by watching their parents, friends, teachers, and religious leaders. They also change with maturity and experience. So, it's through continuous reinforcement that children eventually learn and adopt values as their own. And the number of values an individual holds is not as important as what values he or she considers important. So let's clarify on values. You can go ahead and look on page 2-1 on page 17 of your book. So choosing values are influenced based on achievements and abilities, finances, support, and encouragement. Prizing values mean you're being satisfied about your choice and you're being willing to declare the choice to others. And then acting values are making the choice a part of one's worldview and incorporating it into your own behaviors. Belief systems. So these are organized ways of thinking about why people exist within the universe. They often help survivors in making decisions and living with them afterward. So their purpose is to explain such concepts as life and death, good and evil, health and illness. Morals are individuals' own code for acceptable behavior. They arise from an individual's conscience. They act as a guide for individual behavior, and they're also learned. So next we're going to talk a little bit about ethics. Let's go ahead and define what ethics is. So it's based upon a standardized code, which generally is concerned with motives behind human behavior. So our own judgments can be made about the rightness or goodness of healthcare practices. So again, it's sort of like a guide to judging right or wrong behaviors. There's bioethics, which helps to answer the questions of which healthcare professionals have looked towards with a philosophy with answering these questions. So ethics, the philosophical study of morality, and then biomedical ethics differs because it's a subdiscipline with a focus more on medical morality and issues related to life and death. So there's several different ethical principles that we'd like you to review. So codes of ethics are based upon these principles to help make decisions. For each of the following, consider what it means in nursing care. So autonomy is the freedom to make decisions for oneself. The nurses respect patients' rights to make their own choices about treatment. Nurses need to respect clients' rights to make choices about healthcare. It's closely linked to the ethical principle of autonomy is legal issue of competence. So a patient needs to be deemed competent in order to make a decision regarding treatment options. When a patient refuses treatment, healthcare professionals and family members who think differently often question the patient's competency to make their own decision. But when they agree with the treatment, rarely is there a competency question. Non-maleficence, so it requires that no harm be done, either deliberately or unintentionally. This principle also requires nurses to protect individuals who lack the ability to protect themselves because of their physical or mental condition. So an infant is a person or a person under anesthesia are examples of someone who might fall under this principle. Also, a person with Alzheimer's. It's essentially a patient with limited ability to protect themselves. So think about if a nurse was under the influence of alcohol at work, they are not performing at their optimal level. This is placing the patient at risk. Other nurses who observe or witness such behavior have an ethical obligation to protect patients according to the principle of non-maleficence. So beneficence is the principle that means doing good for others. It requires knowing and being truly understanding of the situation and the thoughts and ideas of the individual. Nurses need to assist clients in meeting all of their needs, including biological, psychological, and social. There's the justice principle, which requires nurses to be non-judgmental and to treat every person equally. So the concept of distributive justice necessitates the fair allocation of responsibilities and advantages, especially in a society where resources may be limited. It refers to what a society or a larger group feels is indebted to its individual members regarding needs, contributions, and responsibilities, the resources available to the society or organization, and the society's or organization's responsibility to the common good. The fidelity ethical principle is the promise to fulfill all commitments and the basis of accountability. Accountability ethical principles mean that individuals need to be responsible for their own actions. So nurses are accountable to themselves and their colleagues. Confidentiality, anything stated to nurses or healthcare providers by clients must remain confidential. Remember HIPAA. The only times this principle may be violated are if clients indicate harm to themselves or others, and if the client gives permission for the information to be shared. The last ethical principle is veracity, which implies truthfulness, and nurses need to be truthful to their clients. Veracity is an important component of building trusting relationships. So on this slide, it might be a little hard to read, but there's provisions of the Code of Ethics for nurses with interpretive statements. So take some time to read through that. There's 9 provisions here, and it talks about the nurse practicing with compassion and respect. Essentially, it's the Code of Ethics for how nurses behavior should be, what their role is, how they collaborate, etc. So take some time to read through these. Ethical dilemma number 1. So let's take a look at page 20. Mrs. Liu, there's an ethical dilemma which occurs when 2 or more ethical principles conflict with each other. So Mrs. Liu was admitted to the oncology unit with ovarian cancer. She's scheduled to begin chemotherapy treatments. Her 2 children and her husband have requested that the physician ensure that Mrs. Liu not be told her diagnosis because they believe she would not be able to cope with it. The physician communicated this information to the nursing staff and placed an order in the patient's electronic medical record. After the first treatment, Mrs. Liu became very ill. She refused the next treatment, stating she did not feel sick until she came to the hospital. She asked the nurse what could possibly be wrong with her that she needed a medicine that made her so sick when she did not feel sick before. She then said, "Only people who get cancer medicine get this sick. Do I have cancer?" So some questions to consider are, what 2 or more ethical principles are in conflict? And I want you to answer these on your own so you can look back at previous slides and go through and answer these questions on your time. To whom do you owe duty? The family or the patient? How do you think you may be able to be a patient advocate in this situation? And what information would you communicate to the family members? And how can you assist them in dealing with their mother's concerns? All right, moving on to resolving ethical dilemmas. So, ethical dilemmas can occur at any aspect of our lives, and the nursing process can be used with finding solutions with ethical dilemmas. So, look at the nursing process and how we apply it to ethical dilemmas. Here's the approach. So, first, there's assessment. Are you directly involved in the dilemma? At times, nurses find themselves working through the decision-making process with people. Collecting data will assist the nurse with identifying the reasoning of those involved. And the following are questions to ask to assist with information gathering. So these are all things involved in the assessment stage. And questions to ask would be, what are the medical facts? What are the psychosocial facts? What are the cultural beliefs? What are the patient's wishes? And what values are in conflict? So that's all a part of the assessment stage. With planning, you want to make sure to include everyone involved in the decision-making process, and you want to determine the goals of the treatment. So there's 3 specific phases of planning. They include determine the goals of treatment. Goals should be patient-focused, attainable, and reality-centered. Identify the decision makers, so make sure you know who is involved and what their belief systems are. List and rank all the options, so share your ideas and share ideas of all those who are involved. Identify the method on how you would work toward achieving the desired outcome. And then with implementation, you want to reach a decision and ensure that communication remains open. Use discussion and negotiation, and then with evaluation, you want to determine whether desired outcomes have been reached, and then reevaluate as needed. So let's reconsider the ethical dilemma. This is another case study with Olivia's mother, Angela, and it's a case study on page 27 of your book. And let's apply the nursing process to resolve the dilemma. So go ahead and read through that, and then we will go over assessment and medical facts, as a family or patient understanding. What are the psychosocial facts of the case? What's the emotional state of the mother and Angela? How's their relationships, living conditions, finances, their values, policies, and laws? Are there cultural beliefs that are involved? What are the patient's wishes? And what values are in conflict? Okay, so now I'm going to help you answer those questions. So if you haven't read the case study, pause right now and go read it. So in this case, the medical facts are the mother has stage 4 ovarian cancer and new chemotherapy drugs can be attempted. The new drugs have proven success in many cases. Psychosocial facts are the daughter and the mother may be filled with different emotions. What's their relationship? What other factors could be involved? Take the time to listen and identify each individual's cultural beliefs and values and patient wishes. There could be conflicts between the mother's and daughter's values and beliefs. So, for planning, there's goals, cure versus comfort. There's the decision makers, know who and what their belief systems are. You may need to designate the healthcare surrogate. And then, of course, implementation and evaluation. So, for this case study, the patient had already developed a plan, which is to try 1 month of treatment, and if there is no improvement, to stop all treatments and live out the rest of the time with their family. And then the family will implement the treatment and eventually evaluate if the treatment is working and make their final decision based on the outcomes. And so if the treatment's unsuccessful in that month, then she would essentially go to hospice care, palliative care, and comfort care. So that is just one way you can look at an ethical dilemma and use the nursing process to help with decision making. All right, so here are some current ethical issues. We're going to talk about assisted suicide, and technology, DNA, stem cell use and research. So, assisted suicide, look into the cases of assisted suicide that are well known, events such as Dr. Jack Kevorkian, who admittingly gave lethal doses of medications to assist patients with suicide, and this was before any laws were in place. Or also look into the case of Terry Schiavo. If you don't know who either of those are, then please look them up right now so you are aware of who and what those situations are with ethical dilemmas and current issues. So on the screen here on the map, the states in navy blue are where assisted suicide is legal. The states in the royal blue color, which looks like it's just Montana, where it's legal under court ruling, and all the other states are illegal. So I remember living in Oregon. We had many patients that would come to the emergency department, and they would walk in, they'd come from other states. They would drive in from Idaho, Nevada, and they would want the ED doctors to prescribe them this medicine so that they can commit the assisted suicide. And fortunately, there are many, many state laws that regulate assisted suicide. And I would say most of the ED doctors would just turn these patients away. So in Oregon, they call it the Death with Dignity Act, and it's a state law, to be a little bit more specific, that allows terminally ill state residents to end their lives through voluntary self-administration of a lethal dose of medication prescribed by a physician for that purpose. Most physicians in Oregon can write the prescription for the lethal dose medication, but many are not willing to write them, and participation is voluntary. So the law doesn't mandate physicians to write prescriptions for lethal dose medications. There are also many, many, many steps involved in how a patient gets a prescription from a participating physician. And you can look up more information on the website is oregon.gov on the Death with Dignity Act. And there is like a frequently asked question page that might be just interesting to review. It looks like I also missed Hawaii too as one of the suicide states that's legal. I have to say that a lot of times we would just refer those patients to try to do some internet research, because honestly, many of the physicians I worked with were unaware of who and what and where to go, and what physicians were willing to prescribe those types of medications for patients. So moving on, other current ethical issues involve technology, all of the recent advancements, including medications and genetic testing. Think about how genetic testing has changed the way that we think of things in nursing and in medicine in itself. Now we can decide if we want a boy or a girl. I think that is something that is becoming more of an ethical issue. And what are your thoughts on that with not only genetic testing, but with DNA and stem cell research and the types of advancements that we're making, and how should we regulate that? And how would you approach that if you were a nurse on the floor and had some stem cell issues that arise, and ethical decisions in the moment? So it's ever changing, and I think that there's new laws that are coming out every year in regards to new science and new research. So as your nurse career takes off and as time goes on, you'll see how much it changes based on scientific research and all of the new technology that comes out in the future. So let's go ahead and look at another case study here. So a nurse works in a pediatric oncology center associated with a major university. The nurse has been caring for Anita, a 3-year-old child diagnosed with a neuroblastoma. Anita has been through the standard treatment protocol and went into remission 3 months ago. The staff is hopeful, but has told the parents that these types of tumors have a tendency to return, and that the best chance is a stem cell transplant from a family member. Anita's family asked that all the relatives be tested, and no one has a close enough match. Anita and her family return for a follow-up visit, and Anita's mother tells the nurse that she is 6 months pregnant and plans to use the baby's cord blood to save Anita. After further testing is completed, the oncologist tells Anita's mother that the neuroblastoma has returned and that Anita will not survive more than 1 or 2 months. Anita tells the nurse that she wants to have the baby now. The nurse explains that the baby needs more time to develop, and Anita's mother states, "I will get this baby's cord blood one way or another." So reflect on that. And so with this case study, again, I want you to pause, and I want you to answer the above questions reviewing the materials from chapter 2 of your book. So is this an ethical issue or a legal issue? If it is an ethical issue, which principles may be in conflict? What are the possible legal ramifications for the nurse? Apply the nursing process to solving the dilemma. And what would you do in this situation? So all things to think about, and getting you to think about what we have just discussed in this lecture and what you might be tested on. There's another case study you can work on. So it's on page 25. And go ahead and answer the following questions. How should the nurse respond? What are the ethical principles in this conflict? And what are the long-term effects of the nurse's decision? Okay, so go ahead and review that. And then lastly here, I just wanted to touch on not to forget to navigate to the publisher's website and complete some of the chapter review questions, which might help you with the test as well. And then work through all those case studies.